Hello and welcome. It is such an honor to be able to present to you guys today. My name is Dr. Dianna Cortese, and I will be speaking about ovarian cancer and your mouth. So, just a little bit about me. My name is Dr. Dianna Cortese, and I am a dentist in New York City. I graduated from NYU College of Dentistry with an honors in oral medicine and pathology. Presently, I'm in my general practice residency program at New York Presbyterian Methodist Hospital. And in just a few months, I will be starting a dental oncology fellowship program at Memorial Sloan Kettering Cancer Center. How does ovarian cancer relate to your mouth? Here's just an overview of the topics we will be covering today. In part 1, we will be discussing what chemotherapy is, its effects on the mouth, and then some tips on managing the side effects. In part 2, we will discuss how ovarian cancer relates to your mouth. We will speak about some current research articles on the various topics. And lastly, in part 3, we will briefly discuss oral cancer and some risk factors and what you can do for prevention. Also, the information I am sharing today should not be substituted for medical advice. It's very important that you still make sure that you're consulting with your doctor. Part 1, chemotherapy and the mouth. So what is chemotherapy? Chemotherapy is a method used to treat cancers using pharmaceutical drugs. While they may be effective for treating cancers in some cases, unfortunately, they can have some harmful side effects on your body. Here's a chart that shows some different parts of your body and some side effects that can happen from chemotherapy. So you can get some side effects such as hair loss, mouth sores, which are very common and we'll speak more about, lots of pain, trouble breathing, a weakened immune system, and lots of other side effects. So why do these side effects happen? While chemotherapy kills the bad cancer cells, it also harms our normal cells as well. Many cancer therapies target cells that proliferate or divide at very fast rates. The cells in your mouth divide often, and therefore, many people experience side effects in their mouths because these cells are targeted in chemotherapy as well. Chemotherapy also disrupts the normal balance of bacteria in the mouth, causing many issues. Chemotherapy also makes it harder for your body to fight off pathogens or the bad guys and the germs, and therefore, you may be susceptible to getting infections in your mouth. Now let's speak about side effects of chemotherapy in the oral cavity. Patients can experience painful mouth and gums. This pain can interfere with everyday life, such as talking, eating, and even swallowing. You can even get sores in or around your mouth, such as right over here. There's some pictures, and these sores can be extremely debilitating, and they can be very painful. Patients can experience xerostomia or dry mouth. They can also experience an increased risk of cavities and gum disease, taste changes, oral infections, not only cavities and gum disease, but other types of oral infections. This is because chemotherapy can lower the amount of white blood cells in our bodies. So white blood cells are just our body's soldiers to kind of fight infection. Patients can also experience burning of the mouth or tongue swelling or peeling, bleeding in the mouth. This could be spontaneous or provoked, meaning it could be just happen by itself or it could be stimulated. And patients can have damage to the nerves. So some more side effects of chemotherapy in the oral cavity. Patients can experience altered growth and development of the oral cavity. So if a child is undergoing chemotherapy, he or she can have altered growth and development of the teeth, for example. Some teeth could be missing as a result, or even their jaws and palates and, any other structures in the oral cavity can be deformed as well. Patients can also experience jaw or muscle pain and stiffness, and also malnutrition and dehydration are a huge issue. These sores and ulcers and infections that we spoke about can be extremely, extremely painful. Malnutrition and dehydration become an issue due to the inability to be able to do things such as swallowing and eating. It's important to work with the nutritionist that's familiar with treating patients that are undergoing cancer therapy. This is to ensure that they are getting the adequate amounts of vitamins and nutrients, and to give their bodies the best chance it has to battle the cancer. So, side effects in your mouth can be extremely, extremely serious. There can be life-threatening infections. Since your immune system doesn't work as well during chemo, even a small infection can be really, really dangerous. It can travel to other parts of your body, and this can lead to a really lower quality of life. And there's lots of pain and discomfort, unfortunately. And it can even lead to delays in cancer treatment. If your oral side effects are that bad, your doctor may have to stop or even cut back on your treatment. And that's not something that you would want. There are many side effects, but this is the one I most commonly come across. Let's talk about some ways that we can mitigate this symptom. First, it's important to stay hydrated and drink water often. I emphasize water because we want to avoid drinks with sugar in them. They're no good for us. We also want to stimulate saliva flow by using sugarless, again, avoid sugar, lozenges or gum. You can also suck on ice chips. We recommend not to chew them because that can break teeth. There are other salivary substitutes that you can use, and you can speak to your doctor about which one might work best for you. It is recommended to avoid alcohol, tobacco, and caffeine as they dry your mouth even more. You can also get a humidifier. I recommend putting it in your bedroom overnight. It really helps with the dry mouth symptom. And even just rinsing your mouth with olive oil every so often throughout the day has really helped people. So it is important that if you get any symptoms in your mouth, to go to your dentist as soon as possible. Your dentist may need to prescribe medications, and there may be an infection in your mouth. In the meantime, you can use these tips at home. Like we mentioned before, unfortunately, many people experience pain in their oral cavity area during chemotherapy. And therefore, many people lose the desire to eat. This can also be from nausea as well. Many different factors contribute to this. So therefore, your nutrition will be compromised. Like we mentioned before, dehydration and malnutrition can be related to this. Malnutrition, there can be poor diet before even being diagnosed. Chemotherapy and even cancer itself can lead to nutritional problems and deficiencies. Many people, their quality of life is very poor and people suffer. There have been studies showing that zinc supplementation has been shown to help restore changes in the mouth and mucositis, those painful mouth sores that we spoke about earlier. Part 2, ovarian cancer and its relationship to oral cancer. There's a few different topics I would like to discuss that are super important. There may be some science terminology that you might not be familiar with. This slide at first sight can seem a little overwhelming, but don't worry, I'll make it really easy to understand. First, we will speak about benign ovarian cystic teratomas, or dermoid cysts, and dental structures. This specific type of ovarian cancer sometimes has dental structures growing out of the cancer masses. Let's learn more about this on the next slide. There have been numerous cases of dental structures, such as teeth and mandibles, or your lower jaw bones, found in ovarian cancers. In fact, they are fairly common in these type of tumors. Let's take a look at figure 1 here. This is a photograph of the tumor mass, and it has several well-developed maxillary teeth growing from the mass, and even palatal rugae, which are indicated by the arrow. And palatal rugae are just the folds on the roof of your mouth, and you can even feel that in your own mouth with your tongue. Figure 2 is the same mass as figure 1, just seen from a different angle. Figure 3 is a different tooth-bearing mandible-like specimen, and that was removed from a wall of an ovarian cyst. So you can see there's a lot of tooth-like structures protruding from it. And in figure 4, this is a picture of a tooth-bearing specimen after removing it from a wall of a dermoid cyst. It's actually an X-ray, which is pretty cool. And then on the bottom right, there is another tumor that is growing about 20 tooth buds. So this is pretty crazy. So now we will talk about PLD, or pegylated liposomal doxorubicin. This medication is used to treat recurrent ovarian cancer. Multiple studies have found an association between the use of this medication and squamous cell carcinomas, which are cancers, or oral leukoplakias, which are precancers in the mouth. So here are some pictures of cases where patients were taking this medication and got oral cancer as a side effect. The oral cancers are these reddish white things that are growing out of their mouth. You can see in 3 different pictures here. Here are some more examples. The arrows in both of the pictures are pointing directly to the lesions. It is well known that some chemotherapeutic agents can lead to long-term carcinogenic or cancer-causing side effects. Some examples of carcinogenic chemotherapy agents are anthracyclines, topoisomerase II agents, and alkylating agents. So there needs to be more studies and higher quality studies on this topic. They really need to explore possible side effects of long-term exposure to this drug. Many factors do play into carcinogenicity, such as environmental factors, dietary factors, and even genetic predisposition at times. Now we will speak about ovarian cancer and hypodontia, or tooth agenesis. What is tooth agenesis or hypodontia? Tooth agenesis is just a fancy way of saying a tooth was never formed during development. The specific type of tooth development that's associated with ovarian cancer is called hypodontia. Hypodontia means that you're missing between 1 and 5 teeth in your mouth. This doesn't include your third molars. Here on the pictures, you could see that there are some teeth missing in these patients' mouths, and on the X-ray, you can see them missing as well. Even in the posterior region or in the back region, there are some baby teeth that are still in these patients' mouths as adults. This is because there was never an adult tooth formed to replace them. There have been studies showing a possible association between tooth agenesis and hypodontia and ovarian cancer. It has been proposed that tooth agenesis and cancer actually share common molecular pathways. Here's a quote taken from an article written by Louisiana State University School of Dentistry in 2018. Patients with epithelial ovarian cancer were 8.1 times more likely to have hypodontia than the healthy controls. In fact, many other cancers besides ovarian cancer have been found to have mutations in the same genes that control tooth formation. Some examples of these cancers include breast, colon, and lung cancers. It's pretty crazy how our teeth are related to the rest of our bodies. It's important to mention because hypodontia can be diagnosed at an early age by a dentist, and it should be considered as a risk factor for certain cancers. Metastasis of ovarian cancer to the oral cavity, which just means that the ovarian cancer has traveled to the oral cavity. Here's a case I came across that I found pretty interesting. A 46-year-old woman with metastatic ovarian carcinoma in the gingiva, which just means that the ovarian cancer spread to the gums in the mouth. 5 years after her ovariectomy, which means that she already had her ovaries taken out. This tumor presented as an exophytic growth at the molar region of the mandible. So that just means that something started growing out of her gum. A lot of the time, cancers that spread to the mouth spread to the bone, not really the soft tissue as much. So this was a pretty rare case. The scientists took a sample of the growth and analyzed it, which was diagnosed as metastatic ovarian mucinous cyst adenocarcinoma. And here's what the sample looked like under the microscope. The point I'm trying to make here is that our mouth is connected to the rest of our body in many ways, some that are still undiscovered. The mouth is not a separate entity. There needs to be more research on this subject, especially with regards to cancer. And part 3. Oral cancer risk factors and prevention. How can I avoid getting oral cancer? First, you need to know the risk factors and the causes for oral cancer. We will go over the oral cancer risk factors on the next few slides. It's also very important that you see your dentist or a dental oncologist regularly. You have to make sure that he or she does a thorough head and neck exam and an oral cancer screening. And prevention is key. So good lifestyle habits and a good diet is really essential for prevention, not only for mouth problems, but for systemic disease. Common risk factors and causes of oral cancer. I'm sure many of you have already heard of the association between smoking tobacco or chewing tobacco and oral cancer. Drinking alcohol can also lead to oral cancer. In fact, smoking and drinking alcohol can triple your chance of getting oral cancer. We also have areca nut. If you've never heard of areca nut, it is a commonly used nut in South Asian cultures, and that can actually lead to oral cancer. Poor diet can also contribute to oral cancer. It is very important to have a diet high in fruits and vegetables. For example, carotenoids, which are organic pigments that are found in pumpkins, carrots, and tomatoes, are associated with a lower risk of oral cancer. Certain strands of HPV, or the human papillomavirus, are associated with a higher risk of oral cancer. Specifically, the HPV 16 and 18 strains are most common. UV radiation can lead to cancers of the lip. A weakened immune system can put you at risk for oral cancer. For example, you can have a weakened immune system due to HIV or AIDS, or you can be taking a certain immunosuppressive drug. Certain mouth conditions, such as urethroplakias or leukoplakias, can lead to oral cancer. And those are just fancy words for types of red or white patches of the mouth. Other mouth conditions, such as autoimmune or inflammatory processes, can lead to oral cancer, such as lichen planus or GVHD, otherwise known as graft versus host disease. Some genetic conditions, such as dyskeratosis congenita and Fanconi anemia, can lead to oral cancer as well. And these are just conditions that have changes in the bone marrow. And a previous history of cancer can put you at risk, especially head and neck, esophageal cancers, cervical cancers, anal cancers, penile cancers, and squamous cell skin cancers. And poor oral health can also contribute. Other possible risk factors and causes of oral cancer. Let's start with family history. Research shows a slight risk if your close relative has ever had mouth cancer. Next is the blood pressure drug called hydrochlorothiazide. So there is a small study showing that this hypertension drug may put someone at risk for developing lip cancer. This may be related to photosensitivity or increased sensitivity to sunlight. Alcohol-based mouth rinses can also put you at risk. Alcohol, like we mentioned before, can be a risk factor for oral cancer. So it is very important that when you're choosing your mouth rinse, to make sure it's specifically labeled alcohol-free. Marijuana can also be a risk factor for oral cancer as well. And like we mentioned before, hypodontia or those PLD treatments can also potentially put you at risk for oral cancer. What is dental oncology? Luckily, there is a branch of dentistry dedicated to helping cancer patients. Dental oncologists are trained specifically to work with cancer patients. It doesn't only have to be head and neck cancers, it could be any type of cancer. Dental oncologists care for patients before, during, and after their cancer treatments. Before cancer treatment, dental oncologists will prepare you for your treatment and catch any problems before they become a worsening problem. Ideally, it would be great to have the patient come in about 2 weeks before their treatment begins. During their treatment, dental oncologists manage problems and prevent any complications that might arise. And after treatment, dental oncologists will manage the oral cavity, teeth, and gums, and any long-term side effects. It's important to remember that not all side effects can be avoided 100%, but it is important to be prepared for them and try to prevent them and take precautionary measures. So here's just some final thoughts and take-home messages for you guys. It's important to consult with a dental oncologist if you've ever had a history of cancer or you're undergoing cancer treatment currently. If you're not able to find one in your area, make sure you contact your dentist. It's important to maintain proper oral hygiene and visit your dentist regularly for checkups. I would also recommend to explore nutritional counseling. Preferably, you would like a nutritionist who works with cancer patients. I just wanted to thank you guys for taking the time to listen to my presentation. Like I mentioned before, I will be beginning my dental oncology training in July. You can visit my Instagram or Facebook page to learn more information. You can contact me via email if you have any questions as well. I look forward to speaking with you, and I hope this short presentation was helpful for you to get on the right track to optimal health.